Good morning. Sorry, I'll have to pardon the cold, but I'm Emily, and I'm going to be talking about IBS today. So, I'm really sorry you haven't been feeling good. I know the doctor was just by here and he gave you a diagnosis of irritable bowel syndrome. And I'm just here to explain a little bit more of what it is and possibly answer some of your questions you might still have. The first thing that it's important that you understand is what IBS is. IBS is the abnormal functioning of the smooth muscle in the gastrointestinal tract, which is your intestines, but specifically the muscles in the large intestine, which is the picture that you see there. It's the most common digestive disorder in the United States and can affect anywhere from 10 to 20% of the population. Unfortunately, even though it's very common, the cause is still not really understood. However, we have a few ideas what it could be linked to. There are some evidences that there's a genetic link, but we're not exactly sure which gene it is. The most common cause that we've identified is inflammation of the muscular wall of the large intestine, which is the one that runs along the outside on that picture. This inflammation can be onset or aggravated by a number of things, including stress, food intolerances and poor diet, disrupted bowel function, prolonged use of antibiotics, or changes in gut microbiome. To diagnose you with this, the doctor was already in here and he did a physical exam on you, and he felt your abdomen, and you said that there was pain with that. Well, the pain that you're experiencing is one of the top symptoms that goes along with IBS. You listed off the other symptoms you were experiencing and mentioned that you'd also been experiencing difficulty when going to the bathroom. That's also very common. We generally look for alternating bouts of diarrhea and constipation with that, and you mentioned that, and it lines up with what you were telling us. You also mentioned that you were having nausea after eating. That's also very common. I'm really sorry about that. It probably makes eating pretty difficult. Some other symptoms that may go along with this that you didn't necessarily mention include mucus in the stool, abnormal bowel sounds, inflammation of the bowels, and bloating and gas. Now, just to be sure that we had the right diagnosis, we looked into your medical history to check if you had any other diseases that could lead to IBS, or if you're taking any medications that could be triggering it, which is important because when we looked into your medical history, we saw that you've been taking a long-term antibiotic. This could be something that may be contributing to this or may have set on your symptoms. I'm getting an update here. Sorry.
Is it the flash player?
Yeah.
Oh, that keeps coming back. Just close it and then it should.
Okay. Sorry about that. The next thing that the doctor would do is he did a physical exam on you. He felt your abdomen and you said there was pain with that. He listened to the sounds of your guts, your GI tract. And then we also did a colonoscopy on you just to be sure that we had the right diagnosis, and we looked and there was inflammation in that large intestine. The next step that we have for you is to do a psychosocial evaluation. A lot of times with IBS, there is a lot of embarrassment or that kind of a symptom that will go with it, and anxiety and stress. So what we're gonna do is make sure that you know how to manage those symptoms well so that the stress doesn't continue to perpetuate your symptoms. There's a 4-step plan that we've got for you. We're gonna manage your medications. We're gonna see if there's something that we can do instead of having you on that antibiotic. It's really not good for you. We're also gonna treat any mental health issues like the anxiety or stress that may come along with your symptoms. We're also gonna manage your environment. We're gonna talk about diet and exercise, and we're going to get your environment under control. And then we'll also manage your pain and comfort levels as you deal with your symptoms. What is so important is the home care when it comes to IBS. It's really up to you. We can tell you all of these things, but it's only up to you to make the lifestyle changes. Something that is super important is your diet. You need to be eating at least 30 to 40 grams of fiber a day, but we'll teach you how to work up to that, because actually if you eat that immediately, it can contribute to some of the inflammation. You need to be eliminating the trigger foods if you know you have food intolerances like lactose or gluten. You need to we are going to introduce you to a low FODMAP diet, and it's kind of hard to explain, but FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which we're going to set you up with a nutritionist and they'll help you understand this further, but I'm just going to give you an overview. These fermentable short-chain carbohydrates are prevalent in most normal diets, but research has discovered that the small intestine cannot absorb them very well. They increase the amount of fluids and gas in the bowels, and this increase in fluid and gas leads to bloating and changes in the speed with which food is digested. A low FODMAP diet, so getting rid of these foods, is shown to have potential to help people with IBS. So we're gonna get you a plan with a nutritionist, and you'll have to follow through with that and learn how to eat properly, eat slow, chew well so that your stomach gets very well broken down food. You need to drink a lot of water, a minimum of 8 glasses a day, and that's outside of meal times. You need to exercise. Having strong muscles is not just good for your body, but it strengthens your gut muscles as well. Another thing that it does is it can relieve those stress and anxiety and depression, mental health symptoms that you may be having. Another thing that you could try are alternatives to medications. A probiotic is very good to restore that microbiome in your gut. Peppermint oil is fantastic for managing digestive functions, and other essential oil supplements are really good for managing pain and gut health and inflammation. The one that comes to the top of my mind is copaiba oil, which helps with pain and inflammation a lot. For follow-up, we're going to get you an appointment with a dietitian so that they can create a care plan that is specific to you. You need to stick to that plan though. That's really on you. If you want to have a good prognosis, which you can live a normal life, but it's really up to you to prioritize your health and exercise and your mental health as well. And we are going to be seeing you every 4 to 8 weeks. The physician usually likes to see patients that often, just to make sure that everything is going well and you're getting healthy and not experiencing those symptoms anymore. For more information on any of these topics, symptoms and causes, diagnosis and treatment, and specifically the FODMAP diet, which can be confusing, here's some sources for you to go to.